Hello, Dr. Eric Klaczynski here with Fanwood Back Relief Center. Today in this video we're going to talk about sciatica. Most people, when you hear the term sciatica, they think back and leg pain, but it's much more than that. To the person suffering it, it actually can be very debilitating. Normal things like walking can become very difficult, bending over. More advanced tasks like playing a sport or going to the gym can be very troublesome. Sciatica itself is a problem because it causes not only a lot of pain, but it can also cause a lot of numbness and tingling and weakness in the leg. So let's talk about it. What is sciatica? Well, it starts with the sciatic nerve. There's a group of nerves, spinal nerves that branch off the spine and the lower spine that come and form the sciatic nerve, which is the thickest, largest nerve in the body, and it passes down the leg through certain muscle groups. Because it's the biggest and largest, it's more prone to irritation by different structures. It can be caused by a spinal disc in the back and cause pain down the leg. It can be caused by inflammation of a muscle, inflammation of a bone that's degenerative, and other things as well in the area that are degenerative in nature. It causes a referral type of pain down the leg. And what's tricky about it is sometimes patients will come into the office with either just numbness in their leg or their toes or their feet or weakness in their leg. And the problem essentially is not in the leg itself. It's actually stemming from the irritation in the spine, usually by a disc or inflammation around the nerve by other structures in an area like we said before. Now there's two ways that somebody will develop sciatica: acutely or suddenly, or more insidious or progressive over time. The acute is more of the person that bends down to pick up something, pick up their kid, raise them in the air, or they're at the gym deadlifting or squatting or doing some sort of weightlifting maneuver where the spine just gives out. And what happens is it passes that threshold where either the disc blows out or the muscle gets strained, and it puts direct irritation or inflammation on that nerve itself, and you will get those symptoms of the electric pain down the leg, numbness, tingling, weakness. The more insidious or chronic nature is something like the person has been experiencing back pain for quite some time now. Getting in and out of their car is difficult. And then one day it becomes, instead of once a month, now it's once a week or it's every other day. Now, whether it's insidious or more acute in nature or sudden, it's a problem, and your body's telling you something's wrong. So whether it comes and goes or it's there all the time, it's definitely something you need to get checked out before there's any irreversible damage. Because the longer you wait, the more it becomes damaged and affected. That nerve becomes more and more degenerative and becomes irritated and essentially doesn't work as well. The message is just receiving along the nervous system. So it's very important that you get checked out. Now, unfortunately, it's not a one-size-fits-all. I can't just give you stretches or exercises. Every case is different. Every person's situation is different. I do urge you that if you are experiencing sciatica or sciatic pain, numbness and tingling in the leg, that you do get checked out by a qualified professional. Here at Fanwood Back Relief Center, we treat a lot of sciatica and have been doing for years with a lot of not only rehab practices but also advanced technology. If you'd like to find out more information, feel free to give us a call or visit our website at fanwoodbackreliefcenter.com. And lastly, if this video is useful, please share it with somebody you know that might benefit from it. Thanks a lot. So long.